Now, I want to start now by giving you a bit of background into how I came to be involved in this project and a little bit about the website's development. So my passion is supporting individuals with a spinal cord injury and other disabilities live their best lives. Now, I believe that the first step to living well with a spinal cord injury or any disability and being able to fully participate in life is maintaining your health and wellness. Unfortunately, secondary health complications arising from spinal cord injuries, such as pressure ulcers, bladder and bowel dysfunction, and chronic pain, are known to negatively impact on individuals' reported community participation, employment, satisfaction with life, and quality of life. So simply put, any one of these conditions can limit your capacity to participate and enjoy life. And I'm speaking from personal experience. As soon as I get a hint of a pressure area, I'm on bed rest, and this limits my ability to work, but it also means I can't go to the park with my daughter and do the things in life that bring me joy. So in theory, if we can support individuals living with spinal cord injuries to maintain their health, perhaps this will give them a chance to actively engage in their communities and improve on outcomes like employment and participation in the community. So that brings us to why I wanted to get involved in this project. When I saw the advert for this PhD that wanted to explore how we can best support young people with spinal cord injuries in their transition from pediatric to adult healthcare, I thought it fit really nicely with my passions and beliefs. So what have I discovered? Research on transition for other chronic illnesses and disabilities suggests that the move from the children's to the adult healthcare services can present a hurdle to maintaining continuous age-appropriate healthcare. As a result, young people get lost in the transition, stop receiving appropriate healthcare, and as such experience health complications. And so I'd like you to take a moment to kind of think back now to when you were 18 and what you were going through at this time. Perhaps you were moving out of home, you're starting a new relationship, maybe you were traveling or starting university or work. Was your health a priority for you at this time? So would you have spent time organizing your 6-monthly bladder Botox, or would you have spent that time planning a road trip around New Zealand with your best friends? I don't know about you, but I certainly know which one I would have preferred to have done. So it's really easy to see how young people get lost in this transitional period. So my hope is that through this project, we can at least ensure that young people have access to information on the healthcare services available to them and are supported to build the skills and confidence required to be proactive in their healthcare. Maybe in this way, young people won't feel like they have to make the decision between their health and participating in life's exciting events. So, after learning more about what the transition process was like here in New South Wales, I began my research by exploring what the experience of transition was like for young people with spinal cord injuries and their parents or caregivers. Regrettably, what I learned confirmed what I had read in the literature, in that the move from pediatric to adult healthcare services is fraught with challenges. So what I found was that young people were scared and overwhelmed about the prospect of entering into new environments, and that this fear became particularly poignant when young people spoke about the trusted and supportive relationships they had with their pediatric healthcare providers and the daunting task of having to start from scratch to establish new relationships. Participants explained that they were poorly prepared for the transition process. What information they had received was verbal and lacked detail. The lack of clarity around this transition process meant that for most participants, the transition to adult healthcare seemingly occurred overnight without a formal handover. Participants reported a lack of communication between pediatric and adult healthcare. which as a result meant that information was lost in the transfer process. As such, they had to repeat their traumatic stories over and over and over again, which, as you can imagine, was quite draining. So after getting a better understanding of what the transition experience was like for young people and their parents and caregivers, I began to question, how can we bridge this gap between child and adult-centered healthcare and provide young people with spinal cord injuries and their parents with the knowledge and skills required to navigate the adult healthcare system? So the aim of my PhD was to co-design, develop, implement, and evaluate an intervention to support young people with spinal cord injuries during their transition. And I want to emphasize the co-design element here. You know, in keeping with the motto of the disability community, nothing about us without us, I personally believe it's essential to include people with disabilities and research on and about them. Including end users in disability research brings a specific expert knowledge based on lived experience to the research, which may not be held by the researchers themselves, and results in more appropriately designed interventions. Furthermore, co-design principles foster empowerment as people with disabilities gain control over their lives and make decisions on matters that affect them. So in the end, we held 2 co-design workshops, both via Zoom, one for young people and one for parents and caregivers. We used what is called the future workshop method to facilitate discussion and generate ideas for the development of the intervention. Now, this method consists of 3 phases. You have a critique phase, where participants are asked to identify the deficits and challenges related to the healthcare transition experience. We then had a fantasy phase, where we discussed, okay, in a perfect world, how can this be achieved? How can we meet that gap? And then lastly, this implementation phase, where we tried to turn these perfect world ideas into a design for a practical and realizable healthcare transition intervention. What was nice is that young people with spinal cord injuries and their parents and caregivers were very clear about their needs and their recommendations. Overall, parents wanted an intervention that supported their children in achieving greater independence. Young people wanted an intervention that offered a space for peer connection, and both requested that the intervention must support a coordinated handover between services. So, in an attempt to achieve these outcomes, participants suggested that the intervention include information on the transition process and the adult healthcare system, not only on the how the transition would take place, but on the services that it could help, what each of their doctors do, so both their old and their new doctors, how the adult healthcare services operate, what medical tests they need, how often, and tips on what questions to ask healthcare professionals. Interestingly though, what was most important was to have this information available for them to consume in their own time. Participants also wanted more written information on their medical history, and they suggested that having a personalized booklet that they could give to new doctors would be advantageous. They wanted the transition to be staggered, so from approximately 16 to 24 years. So in this way, the intervention can assist with those additional life transitions occurring simultaneously. So, for example, the move to tertiary education and work, move to living out of home. Perhaps the intervention could also address common adolescent concerns around sexual health and sexuality, independently accessing the community, driving, and mental health. So as I mentioned, from parents, there was really this focus on providing the opportunity for young people to learn about their healthcare and support services and gain and have the space to gain these self-management skills. And then for young people, there was this focus on accessing support from people with a similar injury so that they know that they are not alone in the whole process. So based on these recommendations, young people and from the young people and their parents, it was determined that a website would be an appropriate platform on which to deliver this suite of information.